My special guest today is Associate Professor Julia Brotherton, who is the Medical Director of the National HPV Vaccination Program Register. Thanks for your time, Julia.
No problem.
You've co-authored a short report for us on the HPV register and some results that you've been able to pull out of the data. Tell us a little bit, I know there's new things coming next year in terms of the national screening program. Tell us a little bit about what's going to happen.
So in 2017, we're going to see the renewal of the National Cervical Screening Program, and as you all know, it's been remarkably successful.
Yep.
Has so far, we've seen reductions in cervical cancer of 50%, so we've halved the rate since that program started. However, the program is really based on old technology. So Pap testing has been around for a very, very long time, and in the same way we don't have the same mixers or ovens in our kitchens that we used in the 1950s. It's really time, it's not that they don't work, it's that it's time to update our technology. Yep. So the new program is going to take advantage of all the incredible randomised controlled trials that have been done internationally over the last 10 years, which have shown that using an Hpv Dna test, so actually looking for the virus that causes cervical cancer, is a far more sensitive way of detecting these precancerous lesions that we're looking for. And so Australia is going to be one of the first countries in the world to actually roll this out to our population. And all the projections is that it's actually going to be a superior test, but also more efficient, and it's going to be a safer test. So it's going to actually reduce cancer even more effectively and actually save us money. So it is
the end of the pap smear.
Yeah, well, what doctors and women do need to know is that in fact you still need to take a cervical sample.
Right.
So the bad news is we're still taking samples from the cervix.
Yeah, there's still going to be...
But the good news is it will be every 5 years rather than every 2.
Okay.
So a significant advantage for women and providers. Yeah. So this is obviously a very exciting new initiative. We're very confident it's supported by very strong data, that it will be very safe and very effective for the women of Australia. And the new research that we've done here indicates that in our population, we already have young women who are at lower risk of cervical cancer due to vaccination. Mm-hmm. And we know that the great thing about this test is it should work just as well in those women, whether they're vaccinated or unvaccinated. So the advantage of a Hpv Dna test is it tells you right now if you have one of those high-risk HPV types present. So whether you were vaccinated and didn't get all your doses, whether you were vaccinated but only had one dose, whether you were sexually active before you were vaccinated and so the vaccine of course doesn't clear the infection, or whether you were never vaccinated. The point is this woman who I'm seeing right now currently infected with a type that could result in cervical cancer in 10 or 20 years? And if it's positive, it's going to send her down a different path than the negative women, in whom we know a negative HPV test result means she is going to be safer 5 years after than she is currently 2 years after a pap test. So the predictive value of HPV testing is one of the main reasons why it's so advantageous. So if you don't have HPV there right now, we know your risk of cervical precancer in the next 5 years is very low.
Tell us about the results that you've been able to extract from your data about 25 to 29-year-olds. Mm-hmm.
So we've been closely looking at the Victorian Cervical Cytology Registry data since the program, the vaccination program started, looking, I guess, with keen anticipation for falls in the number of those CIN2+ lesions, so those high-grade lesions, which are the ones that can, if they're left, result in cancer in some women. Mm-hmm. And we actually were the first to demonstrate anywhere in the world that we did start to see a decline only a couple of years after the program started, and you may recall that was in our very young women, so women under 18 who were screening quite early. Mm-hmm. And as time has gone on since then, we've progressively seen the age group of women who are having drops in those rates of precancerous lesions detected in Victoria declining over time. And the result that we're presenting here is, for the first time, we've now seen that go all the way up into the 25 to 29-year-old age group. Mm. So these women in the last 2 years have had a 17% decline in the number of women who are it's actually the rate of women who are screened who have these abnormalities detected. And this fits beautifully with what we're seeing in terms of declines in genital warts, in terms of declines in HPV prevalence. So when we look in young women now, we only find it in about 1% of women have 16 or 18, whereas in the pre-vaccine era, it would have been 25%.
Wow.
Like, it's absolutely crashed through the floor. And you can now see that in our screening program results, which is just so exciting.
Yes.
You know, we did undertake a massive vaccine catch-up program in this country, but we were vaccinating women who were already sexually active. So we're now just starting to see, even in those adult women, the protective effects of vaccination. So these would be young women who otherwise in the last 5 years would have probably, a lot of them would have been exposed to 16 and 18 and they would have got lesions as a result.
Yeah.
And the fact that we're seeing these declines reflects the fact that those lesions aren't happening because that infection isn't happening. So this is really fantastic news, and it also reassures us that when we introduce the renewed program, which is going to recommend screening starts at age 25, not only will this be a very safe thing to do over and above the fact we now know PAP testing doesn't really work properly in those under 25.
Yeah.
It's the prevalence of these really severe oncogenic HPV types in our community is incredibly low. And so we won't be over-referring women to colposcopy, which was of course a concern. If you had an unvaccinated population and you referred everyone who was 16, 18 positive to colposcopy, we know pre-vaccine that would have been a quarter of all women.
Yeah.
That would not be a feasible strategy. In our post-vaccine environment, it looks like it will be highly feasible and highly effective. So these results just show that the timing is right for Australia to move forward and I think be a world leader in this area.
Thanks for your time today.
You're welcome.